Good afternoon, everybody, and welcome to this Cap Times Idea Fest virtual panel session, talking about the burnout and the emotional health of Wisconsin healthcare workforce. My name is Anna Hooker, and I'll be your host today and your moderator for this panel. I am responsible for operations at Exact Sciences here in Madison, Wisconsin, and I have a phenomenal panel of colleagues that have worked alongside, hand by hand, with all of us have worked together basically in Wisconsin to serve our patient population and our clinicians during the COVID pandemic. As you know, healthcare is already under a lot of incredible pressure and stress. And these last few years have been especially challenged. So I'm really looking forward to talking to this great group of team members about these challenges and perspectives. So I am going to have the panelists introduce themselves, and I'm going to start with Karen. Karen, if you don't mind, and then pass it to the next panelist.
Sure, I'll be happy to. Thank you, Anna. My name is Karen Lewis. I'm the Regional Vice President and Chief Nursing Officer for SSM Health in the Wisconsin region. So SSM Health is a Midwest Catholic not-for-profit system, but we do have a large presence in Wisconsin. We have about 14,000, a little over 14,500 employees and physicians with 7 acute care hospitals, including the local St. Mary's Madison, 10 post-acute care facilities, and over 85 ambulatory and outpatient facilities. So we're very happy to contribute to this conversation. It's an important one for both our teams and our community. Thank you, and I'll pass it to Janelle.
Hi, everyone. Good afternoon. I'm Janelle Heinrich. I'm the Director of Public Health Madison-Dane County. We're the local health department here, serving all of Madison and Dane County. Appreciate the opportunity to be part of this. Sometimes public health is not a little bit overlooked, but we've had a significant role in more public role in the last couple of years, and that's definitely had an impact very intensely related to this topic for our employees. So happy to be able to share our experiences.
Good afternoon, everybody. I'm Ken Loving. I'm a practicing family physician and the CEO of Access Community Health Centers. I did my training at the University of Illinois in Chicago and my residency at Cook County Hospital in Chicago as well. And I started at Access Community Health Centers, which was then called Madison Community Health Center, 27 years ago, October 1st. I was the first full-time physician at Access, and as we grew, I became the CEO in 2010. And I'd just like to introduce our organization as well. We're a federally qualified healthcare center, and there are over 1,400 of those across the country, 18 in Wisconsin. We primarily care for patients that have barriers to getting health care. 90% of our patients are under 200% of the federal poverty line. We mostly see people with Badger Care and people without insurance. And we have a sliding discount for people that are unable to bill insurance company. Our model of care that we employ is unique. It's not just medical care. We also have a large dental practice. We have an integrated behavioral health group that works alongside us in the medical clinics. And we have low-cost pharmacy services for our patient. And really, our staff is what makes all this happen. So I'm happy to be here today to talk about burnout, which is real, and how we try and support our staff and help them excel in the critical work that they do.
Thank you, Ken, for that. And as you can see, all our panelists have had significant involvement during this pandemic, and they are experts in this area. I can tell you that if we want to see the magnitude of how much COVID really impacted our workers, just in the testing side alone, which is the part of the business that I'm responsible for, we did 4.5 million COVID tests since the pandemic started between April 2020 and June 2023. So as you can imagine, that's a lot of testing, and that's just the testing part. Imagine multiply that by the nurses, the health department and all the work they had to go and do with all the confirmations and the community care that has to be managed with people like Ken's team that can manage. So this is a very, very important conversation. And I'm going to start by asking everybody, and maybe I can start with Karen, but I would like, how would you define healthcare worker burnout, and what are the key signs and symptoms, and help me understand, how is that different from occupational burnout or moral injury? You hear all those terms interchangeably. Can you level set us to start a conversation about what does it all mean to you and to all of you?
Sure, I'll be happy to. I think I can probably speak to part of that question and then turn it off to my colleagues to address some other parts. I think we know as humans and individuals that many of us suffered stress and what we would call burnout during the pandemic, and really since the pandemic. A lot was going on. A little bit that really defines occupational burnout is somebody could be experiencing stress and burnout because of everything that happened with COVID and staffing, et cetera, with the pandemic in their homes. But in the occupational area, typically what you see is really a high degree of emotional exhaustion. And that can be too much work. That can be too much work in the pandemic with the emotional burden of worrying about their family at home, loved ones in the community, whether they can give care and the right care to those that are in the hospital, and frankly, also their colleagues who were also suffering from, they and their families were suffering from the disease or having to be very careful and really being isolated. Something else you see is a low sense of accomplishment at work, or really not feeling that you're doing your job effectively. And I can speak from being a healthcare worker, it adds another element to it when not only are you not doing your job, but you don't feel the satisfaction that you're really giving the patient your all, the patient and the family, because we really try to take care of the patient and that patient's immediate community. You know, and it can happen in any profession, really, but in healthcare, it's not only that worker that's affected and those around them, but if you think about it, if we have collective healthcare workers that are really going through occupational burnout and have these signs and/or symptoms, that can really have a negative effect on our whole community's well-being, and how we can really impact it and the community's health in many different ways. And I think we're going to get into some examples of that a little bit later in this discussion. If I could turn the moral injury part over to Janelle or Ken, I think, just to take that discussion to another level.
Yeah, I'd be happy to jump in and add a few things here. So when we talk about, I think for public health, and I think this happens in healthcare workers, especially during the pandemic, but I know it's been documented and kind of weighing heavily on the public health workforce is that moral injury, and that it's different than burnout. And it's defined as the cognitive harm somebody experiences when we think what we're doing is right and helpful, is not being viewed that way by others in the community. And we know that our public health work has often been political. It has never been politicized as much as it was during the pandemic. And, you know, we had to do a lot of things for the benefit of the whole community that didn't make everyone happy, to keep everyone well. And so that was an added element that I think a lot of folks are experiencing, and it really impacts our value system. It's an add-on to the burnout, the occupational burnout that folks are experiencing, which I would also include, right? We had to pivot and do a lot of things really quickly as organizations that perhaps we didn't have all the systems or all the resources we needed to be able to communicate or to support staff in the ways that we would want to. And communication may have been lagging, which adds to those things of just feeling burnt out in our workforce when we're trying to work really hard and deliver our services, but know that there are things that are a little less stable around us than they were in the past. And then I'd also add that when we talk about burnout, we also need to talk about compassion fatigue, right? And we're caring professions. And I think the intensity of the work and the care ramped up during the pandemic. We were seeing things and caring for folks, like I said, without sometimes all of those resources or to the ability that we wanted to be as successful as we could. And we were also having to care for our families at home who were experiencing what we were doing, what our staff were doing during the pandemic, and then what the population was experiencing as a whole without a lot of break. So it really was a multiplier, I think, of things that are happening all the time, but it all came together.
Yeah. Before Ken steps in, two examples, I think, of what Janelle was speaking to on us having to do things differently that really jumped to mind for me is one of them was the first time in the hospital when one of our patients was passing and the family could not be there at the bedside. That just doesn't happen in the acute care setting. And instead, to Janelle's point of using technology and other things, one of the things we did differently in healthcare was bring the iPad in and try to at least connect with the family at end of life using some sort of technology so they could in some way be connected to what was happening. And the second example is a conversation I had with a nurse from critical care. Our ICU nurses nationwide, probably internationally, are used to taking care of our sickest of our sick and used to helping those patients recover, get better, get out of the hospital. And one of our nurses came to me just in tears and felt like she needed to have a break the next week, and said that in the last 2 weeks, she had seen more patients die in 2 weeks than she had seen her entire career. And that was incredibly touching, and having to go through that. 3 of them in the last 48 hours have been in the age range of 30 to 40 years old. I talked to her, I held her, we cried together, and I told her to go. And that's what we had to do, and pivot and be flexible, exactly, and respond to those needs of the teams that were providing that care. Ken?
Yeah, Karen, I appreciate your story, especially that first example that you gave. It's just a good reminder that the pandemic continues for many people in our community, and I just thought of a particular patient when you mentioned that who wasn't able to be there with her mother, and that still haunts her, and it still is very difficult for her, and to the point where it still impacts her health. So I think that's an important thing for us to remember as we think about our staff and our patients and sort of the continuing effects of the pandemic. And, when I think of burnout, I think about people sort of withdrawing from the things that make them successful in both their personal lives and their professional lives. And I think, personally, they're just small examples like stopping the things that require effort, but eventually have a big payoff, like exercising or cooking for oneself or reaching out to friends and community members. And then, from a professional perspective, one of the key things that we try to do is build trust. And trust is such an important part of the medical world and healthcare in general, and achieving good outcomes for patients. And when your staff is burned out, or people are struggling with burnout, those little things often go by the wayside. The things that help build trust, like being polite, being very personable, being as patient as you can be as people try to navigate, which is oftentimes a complex health system that we have. And building trust is really about making that extra effort to make sure people have a positive experience. And it's very hard to do that when people are struggling with burnout.
Thanks for that, Ken, because my next question had to do with the impact on the healthcare systems, and I was going to start up with what is the implication of the healthcare worker burnout on patient care, and you just answered that beautifully. But I also would like to put it out to understand what is the implication on safety and also on healthcare costs. I don't know, Karen, if you want to take that in terms of the impact on the systems and the healthcare costs and safety, that would be great if you can kick us off with that one.
I think I have a few thoughts about the impact on the healthcare system itself, and then probably a couple on society. For the system, obviously, higher turnover, very costly. Agree with that. Because of that reason, sometimes there has been less continuity for patients in their care team, which can result in things being missed and poor outcomes, which we try very hard to ensure doesn't happen. Burnout can lead to a loss of empathy. I was just thinking about what Ken said about trying to be polite, personal, and positive. But, empathy is an emotion. It's an emotion we want to have. And compassion is sort of the action that goes with that empathy. That polite, personal, positive attitudes and techniques are very difficult. Those compassionate actions are very difficult to come up with when you're struggling to have that empathy. And that can be a high cost on patient care and outcomes both. I think turnover in itself in that healthcare team can lead to reduced access. It can be reduced access in providers' offices, in public health, in anything that's really needed at the time when you've got fewer people to deliver that care. And I think probably one of the top ones, at least, that has been front of mind for me lately has been with healthcare workers have less time with patients. Then they have less opportunity to learn their story, find out what's most important to that patient. This can have implications on how we design and deliver the care for each particular patient individually. Listen to the patient, listen to the family, what those needs are. And if we have difficulty doing that, that can lessen the family and patient satisfaction with their experience and truly drive up the cost of care when we focus on task rather than the value of that care we're delivering and meeting those needs. Right now, patient engagement, patient satisfaction took a real nosedive, I would say, during the pandemic and shortly after. We're happy to say that is on its way up, back up, and we're actually celebrating getting back to pre-pandemic levels at SSM in Wisconsin. An action of compassion that goes with that empathy that we're seeing now, and our nurses and our providers are really engaging with is commit to sit. So we have all decided to truly commit to sit with our patients when we're doing the admission, when we're having conversations, when we're preparing for discharge. Be present with that patient, eye contact. That helps drive that empathy and that compassion in itself. And it can help you be more present with the patient, tune into them better. And it's been interesting because two reactions we've had. I was speaking to a new to practice nurse who said she was telling me that she had started the commit to sit, and she sat down with a patient that morning, made sure she had eye contact. And she said, wow. She said, all of a sudden, I forgot everything else going on. And I was really right there in the moment, and I said, that's exactly what we want. And then another example that was actually shared with me this week in the Fond du Lac region, we had a patient that was in our hospital that typically goes to a competitor, and one of the nurse leaders was rounding on him. And he said, he wanted to know what was going on here. And he said, these doctors here, they're like sitting down to have a conversation and they're using words I can understand. And we were like, yay, that's something to celebrate. So we're really trying to feed that, because those things feed buckets. That makes our caregivers feel better. That reduces those burnout symptoms. They're giving more and caring for the real patient. So those impacts of the burnout, I feel like are maybe starting to be reduced some. Impact of burnout on society. it can cause an erosion of trust, truthfully, with the healthcare system, from society to the care we're providing. It can have impact, worsening population health, increased health disparities, and really for us as a community, a lack of preparation for the next crisis, healthcare crisis, or the next pandemic. So it can be very detrimental in some elements. I think we are heading out of it, but it's going to take a lot of attention by all of us and contributions by all of us.
Thanks, Karen. Anybody else wants to add anything to that question before I move to the next? Janelle or?
Yeah, I would just add too that I think that, we talked about burnout and the little things that people don't do when they're burned out. And I think one of the biggest challenges of working as a medical provider and in the medical world is to leave your judgments behind. Because we as humans, we tend to judge people right off the bat. We have our own biases. We all do. There's data that I learned about earlier in my career about how long it takes for the doctor to interrupt a patient in the room. And it's, like 13 seconds, or it was at the time that study was done. And so that idea of kind of checking those judgments and moving forward and getting to the heart of what the patient feels like they need is a key component of that. And I think that, during the pandemic and coming out of the pandemic, especially when we're short-staffed, I think that's a real risk for people becoming burned out. And as we've started to staff up again and be able to provide the kind of care that we were before the pandemic, it's really made a difference in the just overall well-being of our staff, because working shorthanded is one of the hardest things that you can do in any job. But, especially when you're taking care of people that are sick or that are trying to improve their health, it's hard to do that effectively.
Thanks, Ken. Yeah, this is very critical, how effectively you implement these things and how do you deal with those implications and move forward. And thinking about moving forward and thinking about support, prevention, how we cope with these situations. Janelle, can you share with us if there are any specific programs or initiatives that your organization have worked to address and mitigate burnout, any strategies or interventions that have been effective for you guys to deal with this in your area?
Yeah, thanks for the question. I was really thinking a lot about this as I was listening to you, Karen, because one of the things that I think it starts with is that organizational commitment. And through that is communication, right? We have to start by acknowledging that this is real and that just naming it. And during the pandemic, we had weekly meetings. We disrupted our constant, days were long, days were filled, but we tried to put a placeholder every Wednesday, I think it was, maybe it was Tuesday, I don't remember, but once a week for about 30 minutes, just to have a quick check-in and to help level set what was happening across the organization, to help forecast what changes might be coming, and to also honor, really lean into the acknowledgement that what we were aware of the burnout and the intense experiences that staff were having. It's been communicated to me that that's a first step, right? It's not the solution, but it's a step forward in just making that recognition, that acknowledgement, that care is being shared with across the team, from leadership, up, down, sideways, and otherwise. And then we have to really look at our organizational practices. How are we making space? I think that point around, let's just sit down, that sitting down is an intentional act, that space and that acknowledgement that we want to have high quality care to the folks that we're serving. But sometimes we have to do, sometimes fast does not lead to better results, that slow does. And we have to make space and to support folks in having opportunities that might be adjacent to their service delivery in helping build the culture and to identify things that will be helpful in minimizing burnout in the long run. But we also have to create space so for that to happen. Some things that we're doing in public health, we pre-pandemic, we started working with an infant mental health practitioner to provide reflective consultation to our teams, to some of our teams, and to some of our teams that were involved with the most intense case management services to folks in our community who are at risk of poor pregnancy and birth outcomes, and having a lot of traumatic experiences in their lives, which was creating that, adding to the compassion fatigue and the secondary traumatic stress that our staff were experiencing by kind of vicariously taking on their clients' stress, but it supported what that did is that through that reflective practice, it created a sense of community differently amongst our team, because our staff would engage with that practitioner on a one-on-one basis and on a team basis. And the whole intent part of reflective practice is to reflect upon what you did, what you didn't do, what you could do better, and how that would impact what you experienced, and how I think part of that also leads to that point about judgment. What were you carrying in that space that you perhaps want to show up differently in the future to create a better care model or service delivery for our clients, right? So we did, that was happening in small pockets in our agency before the pandemic. During the pandemic, we opened that up to everyone in the department, and that created a lot of support. That was this intentional, not just our larger agency, our city and county government, but the department itself was really making a commitment to provide resources to staff and talking about, and numbers grew. I think at one point, maybe half the department was engaged with our mental health practitioners in that way, and the really led to helping build some of that trust back up, that acknowledgement of the care that we are trying to offer to the whole team. So that's one example, and I have more, but I'm gonna stop now and let others jump in and share a little bit as well.
Thanks, Janelle. Karen, Ken, do you have any examples you want to share with our audience?
Sure, I'd be glad to do that. I'm sure, Karen, you have some examples too. You know, when I think about this, it risks sounding like a bit of a laundry list, because we've tried so many different things. And I think that's part of us showing that we understand the importance of this. You know, how do we make sure that we're really appreciating people on a regular basis? Because people need to know that the work that they're doing is being recognized and appreciated. And so, you know, I mentioned a minute ago the staffing piece, because it's one thing for us to say, well, we're going to get, you know, a taco truck or a coffee cart or a ice cream parlor to come to the clinics, and you can spend some time mingling together at your lunch hour. You know, that's an important thing for us to do. But really, staffing is what is most important, and what really makes an impact on people. And so what we realized was we weren't able to recruit support staff like we had in the past. So dental assistants and medical assistants in particular. So, you know, about a year ago, we started training those people. So we would, you know, put out job postings for people to come and learn to be a dental assistant, as opposed to saying, you know, you have to have already qualified that. We'll pay you like you're a dental assistant. We'll give you the training that you need, and here are some ways you can advance in the organization. So I think those sort of structural things that you change are really important. And then there are things like we got the Calm app for all of our employees as a benefit, so that they could get that and download that for free. We also looked at our PTO policy and made it more generous for people. We sort of relaxed our late arrival policy so that we weren't, writing people up if they were 2 minutes late when they came to work. And we've really focused on our organizational structure and having sufficient management to support and train our staff so that they come and they learn and they can do their job effectively, and they hopefully then will stay. And we've had some improvement in our retention rate, I think, because of these efforts. The other thing I want to focus on is diversity, equity, and inclusion work, because truly the people that are going to contribute the most and stay the longest are people that feel like they are recognized and that they belong in our organization. And those are the kind of intangible things that make people stay. And so we've built a much stronger infrastructure around that we're continuing to build out. And the other thing is looking internally and trying to evaluate who on our staff can be helpful, because staff members are really trusted in a way that a consultant might not be. And so we have these lunchtime sessions, we call them employee development institutes, and we have one of our psychologists who helps plan those and present these topics that focus on self-care and work-life integration and the importance of appreciation and recognition. And so I think that is a financial commitment on our part, but also helping our staff see that this is really something that we're going to be doing long into the future, and it's not just a result of a difficult time during the pandemic.
Yeah, that's excellent. Karen, do you have an example you want to share?
Yeah, absolutely. And I agree with Ken. It could be a laundry list, but I think there's no single answer, and it's going to be a combination of things. And that's why some of our responses are so diverse and across a wide continuum. Just to highlight a few things, I think from a leadership perspective, we're truly working on leadership development, because well-run departments tend to function better, have more confidence and trust and support for each other, and to help ensure our employees and our leaders can recognize emotional burnout, occupational burnout, those signs and symptoms, and can reach out and really help that person before it gets worse, and emphasize that occupational burnout is not anybody doing anything wrong. That is something they feel, and we're there and need to support that. I agree with Ken. We're focusing a lot on the DEI efforts, and then that culture of belonging and everybody belonging. I really like emphasizing the inclusion of the frontline team and coming up with some of the solutions too. We have one of our nurse leaders from Monroe that's working with a group of frontline nurses from across Wisconsin, across our region, from each of our acute care ministries. And they have created a task force to come up with innovations and staffing. So as we get teams hired and really get them onboarded well, what can we do differently? And I love the fact that they're really engaged in that. The technology part of the workforce. We really need to support initiatives, and we are at SSM, that make healthcare technology more human-centered and less technology-centered. And part of that is something called Project One right now, where we have a group of IT, information technology team members, nurses from actually across the system, but the majority are from Wisconsin, and members from Epic. And we're looking at nursing documentation and electronic health record. Studies show that nurses spend over 40 minutes per patient per shift in that electronic health record. And so this team is looking at it closely to see where there's redundancy, how can we help get the nurse back to the patient, back to the work that's truly fulfilling, but ensure that patient has a clean, accurate record. I guess, and the last thing I would speak to is we're working collectively. We have two physicians, Dr. Heather Schmidt and Dr. Matt Dahl from our greater Fond du Lac area, that are helping us lead lead SSM Healthcare and the Wisconsin region through trauma-informed and care and then HeartMath. So if you haven't heard of HeartMath, for more than 30 years, the HeartMath Institute has been researching the heart-brain connection and learning how the heart influences our perceptions, emotions, intuition, and health. And really, HeartMath helps you tap into the power and intelligence of your heart. So your heart's intuition on what's going on, and it can awaken a person, a caregiver, really to the best version of themselves. And so we have team members who are going to be frontline and leaders who are going to be trained in the HeartMath, and will be there for each other to support each other and help us open up and come to our best selves. And then last but not least, we are working a well-developed care for the caregiver. So a really good peer and group support system to help those who are feeling a little unsteady or heading towards that burnout, and figure out ways for early intervention to help them before it reaches a crisis level. So a lot of things going on that we're hoping will help.
Yeah, thank you for that, Karen. And you pretty much got my next question just set up for me. But before I ask the next question, I want to remind the audience to please submit any questions or comments to the chat. My next question is, I want to put it for Ken here to start, kick us off. And I would like to put it out there. Pandemic brought us a lot of pain and a lot of suffering. However, it also brought opportunities for things to be done differently and for breakthroughs and different innovation to come across that both have helped us bring care to patients' homes, bring care, we're using telehealth, lots of different options out there. And can you talk a little bit about any technological solutions that can help reduce a lot of these administrative burdens that Karen and all of you have been referring to as part of this situation that COVID brought?
Yeah, sure. You know, I think probably the most important one that we would identify as telehealth, because you know, when the pandemic first started, we basically, you know, in those first few weeks, we were trying to keep as many people out of the clinic as we possibly could. And so we gathered all our providers and all our staff and said, we're going to try to do what we can via telephone right now. And it was a big dissatisfier for people, as you can imagine. I mean, the providers had not had experience with this. We were worried about whether we'd be able to give reasonable care to our patients, and but we really didn't have any other options at the moment, you know, at that time. And so we learned that telehealth can be very effective, and that patients oftentimes enjoy not having to get to the clinic. And transportation, especially for the folks that we serve, is a huge barrier for them getting care. And so that telehealth solution has been important. And, you know, we've been talking about telehealth for probably 15 years prior to the pandemic, I think, across the medical field, but not a whole lot had really happened in that. And then suddenly, you know, in 6 months to a year, we were doing this regularly, and we continue to do it regularly. And so I think that telehealth is a really important piece of what we'll be doing into the future. And, you know, when I think of those telehealth visits, they're sometimes frustrating because, you know, if somebody's telling you they have abdominal pain, or, you know, you want to examine them. But if people are saying, you know, I need to be screened for colon cancer, and Anna, you're going to like this example, you know, we're able to order Cologuard for them over the phone, and they don't have to leave, and they can be screened. They don't have to leave their home, and they can be screened for colon cancer. And that is something, you know, that is really transformational, I think, for our patients. And they appreciate it immensely. And we've seen our screening rates go back up to the level that they were prior to the pandemic, after they'd taken a significant dive. So that's one example. The other one, briefly, I'll just agree with what Karen was saying about telehealth, or I'm sorry, about the EHR. You know, the EHR is so important and so useful, but it is often the bane of the existence for the clinicians. And so making sure that you spend the time and the resources to get people trained as effectively as you can, and to focus that training on making it easier and helping the providers and clinicians save time is really important too.
Yeah. Karen, do you want to jump in there and talk about any other technological solutions or things that you have used at SSM?
Well, I can speak to a little bit of agreeing with Ken. I mean, telehealth has ended up opening a whole new world to us. And then right now, we are also working towards, while we provide post-acute services such as home health and home hospice, et cetera, we are also looking at skilled nursing facility at home. How can that be provided? Really looking at hospital at home. Some of you may have heard that particular phrase. And so we are very much have team members, experts looking into that. I have been fortunate enough to be asked to serve on our system steering team for remote patient monitoring. What are other ways besides telehealth that we can monitor these patients in their homes without having to come in and really get a real picture of how things are. So I think I agree with Ken. It has opened up a whole new world, and just to twist it a little different direction. So the things I was speaking to are things to help patients and families stay out of the hospital and improve their care for our community. On the flip side, it has also opened us up to virtual nursing. So a way to look at how do we keep our more tenured nurses who have that wealth of experience, keep them in the workforce. And so maybe they've been in healthcare like I have 40 years, and you've worked for 40 years on concrete floors, the hips and the knees start to go, right? And but we want to keep that knowledge here for us and to help us reinforce the care with the new ones. So we are, as a system, start SSM exploring virtual nursing and expect to go into that so that we can have some of that knowledge watching many patients, supporting many nurses virtually, and being there at the touch of a button to see a patient, join in on a conversation, help reinforce newer to practice nurses' judgment with additional information. So I think there's going to be lots to come from that perspective too.
Thanks, Karen. Janelle, I want to ask you, in light of all these recent challenges like COVID-19 pandemic, what do you foresee are going to be the future trends in healthcare burnout and the healthcare worker burnout, and how should our industry and our whole Madison community should be looking at this and prepare for it?
Yeah, I think it's a huge question, and things that we may not know, but I think some of the things that we've talked about today is that doubling down on the organizational commitment for the long term, right? We've continued to reflect upon this is not a person, this is not a staff member individually responsibility. It's how do we as an organization show up to minimize that those experiences and to prevent our staff from getting to that place of burnout. So really being really intentional in carving out space and supporting us and recognizing that care delivery is yes, that's our bread and butter, but we have to invest in our staff so that they can contribute to us for our organizational success, for everyone's benefit. And so those are some things that I think we've themed out throughout the day. We've spoken about from the perspective of really engaging staff in that development of our organizational needs. One of the things that we haven't talked about, but I think would be really helpful, at least from a public health perspective, is just how are we investing in training for those unknowns? We talk about it a lot from the preparedness perspective, and where we experienced in public health, we had a very high level of training across the department about what to do in these potential emergency situations. But when the rubber hit the road, it really, I think, we didn't get deep enough so that folks might understand the impact of being redeployed and reassigned to work in these very short periods of time with different responsibilities, less communication, new teams, and how do we invest in that now so that if and when, I hope it's not another COVID-19 pandemic, but we're going to have other emergencies that we are going to need to pivot and redeploy to, and really invest in that for our collective future. So I think those are a couple examples, and making the time and space for relationship building across the organization. All of us have folks in different departments, different locations, right? And they may not have relationships with folks and others, but our shared success needs each other. So how do we create those opportunities for our organizations?
Very true. Karen, any thoughts about this that you want to add? Karen, you want to go?
I think there's another element, sort of like Janelle, another element that I would just like to touch on that we haven't yet. And it goes back to the beginning of this conversation, really, where we were talking about burnout and stress of us as a population in going through the pandemic and since the pandemic, and then the occupational stress and occupational burnout. In the midst of that, and with many other factors affecting it, we have seen a dramatic increase of workplace violence against the healthcare workers. And that has really paid a price in turmoil in adding to that occupational burnout and stress. There are certain, really any area in the hospital can experience it, but there are some that experience it more frequently in the ED, but it can be in our inpatient care areas and others. And frankly, we have had healthcare workers injured in the line of trying to care for patients and or families. And this is not just a Wisconsin thing. This is an SSM. This is truly a national pandemic. So we're really, we're working a lot internally. So that is one of our focuses or key performance indicators that we're working on. How do we reduce workplace violence? And we have teams really across our system working on it. And also from a policy standpoint, here in Wisconsin, we've supported our workforce from a safety perspective by strongly supporting and advocating for the 2021 Wisconsin Assembly Bill, Protect the Front Line. And that would make it a Class H felony to commit battery or threaten a healthcare worker. Our testimony has been to support that and to truly be able to do whatever we can in the workplace. We want our staff to feel supported, educated. I mean, Janelle was speaking to the organizational support and administrative support. We need them to feel safe in the workplace, and we need to prevent that violence because that truly adds to it. And I've just Wednesday am finishing 12 town halls across Wisconsin. Those town halls have been with frontline nursing. And I will say that is one of the topics and themes I've heard is as much as they are trying to provide that care and we're trying to provide that setting, the just really unexpected violence they are feeling. And it can be verbal violence and it has been physical violence. So I think that's been one of the topics that we haven't really spoken to that's been a huge impact in burnout and the security that our teams feel within when they're doing their work.
Thank you, Karen. Ken, anything you want to share?
Yeah, I would just say, I think the thing that we're focusing on most right now is retention of our employees. And I think that that's really, we used to talk about recruitment and retention, and the recruitment was always sort of the main point of those two terms. And retention is just so important, because when you go back to the question of trust, and the patient's understanding that when they call in, they talk to the same person. When they come to the clinic, they see the same person. They see their provider, it's the same person. That's what winds up building trust. And I just I think it's incumbent upon us to understand what our employees need, and to put in place, within reason, of course, what they need, and be sort of continually listening to the people that are doing the work on the front lines every day, and making their job as easy as we possibly can.
Yeah, those are great points, Ken, because I think that the more we talk about all the impact and all the burnout and all the negative things that went on through all these last 3 years, a lot of good outcomes are coming in terms of how are we going to help our workforce, how are we going to help our colleagues, how are we going to support each other, how are we going to be thinking about these things, whether it's working on policies, whether it is getting better ways to work with telehealth and work remotely, or even having training programs within your system to help engage new workforce into bring them in, right? All of those things are remarkable, and all of you have been incredible examples of doing all of that. And I would love to invite every single one of you to give us some closing remarks before we finish our panel. And I would love to start with Janelle, if you want to give us a few closing remarks and your takeaways from our discussions.
Yeah, thanks for that. I'm always the introverted thinker, so going first is my but I think when we started this conversation, I was wondering, oh, will we be able to talk about this for an hour? And it's we have, right? It's nice to be in community with each other and to listen and to learn that we have a lot of shared experiences despite what we've done. And I think that I'm really heartened to be able to lean in and maybe connect again with folks around strategies that are being deployed in our organizations and how we might be able to tailor and adapt those. But I think the theme that I wish I could have had more time, because the laundry list goes on of the ways that I'd love to be able to lift up and appreciate all the work that our staff is doing, and to make us a better organization in pursuit of our outcomes for the community. But I think the key takeaways for me are that this is a continuously kind of a CQI, continuous quality improvement effort, where we really need to be engaged with our workforce, with our staff, and listen to them, as you said, Ken, really closely, and to create opportunities to work together to get better and to be better and to support each other. So.
Thank you. Karen, you want to go next?
Sure.
And give us your final thoughts.
Sure, happy to. So hopefully, I'm hoping our community and the public hears that a validation of, yes, not only did we have a pandemic, but yes, we have been suffering occupational burnout. We have had team members doing that. And we have all of our businesses in providing healthcare have been and are continuing to work through this. We don't have it all worked out yet, but hopefully you heard from all of us that we're committed. Our organizations are committed. We're being present with each other. We're being present with our team members, and hopefully you feel our team members being present with you. If you need any of our care, you or your family. And that I think if we work together, both with empathy and those acts of compassion, to continue raising the bar and finding our new normal, then we'll all be in a much better place.
Thanks, Karen. Very true. Ken, last but not least.
Yeah, thank you. I would just say that I really appreciate the opportunity today. It gives me a lot of optimism. And when I think, we talked a lot about the pandemic, and when I think back to our community, I really think of Janelle's bravery in the face of COVID as really the representative of our city and our county. And Karen, and you weren't here during that time, but the support of SSM in the community and their innovative vaccination practices during that time was really inspirational. And then Anna, your organization at Exact just stepped in and did incredible work. And so, this is just an example of sort of how our community can address these problems and work together. And I know it's the same thing in other communities across the country, and we really need to work together to continue to face these challenges.
Yeah, very, very, very well said. It was a community effort, and that's one thing that I'm incredibly appreciative to live in this community, because everything end to end in this community was all about teamwork at every level that I experienced here in Madison, having to come into work every day and having my teams and your teams going to work every day. And we didn't have the luxury of staying home and feeling that safety of not being exposed, but having to come in and not know how bad this was and how dangerous it was, and trying to really go through all that. So it is real, and it was real. And I hope at some point we have a conversation about what else can we do better? What can we continue to do better? And how do we tackle the next one? This is a conversation that can go for another hour and still be going. So I want to thank all of you for your contributions, for being part of this panel, for being my partners in all this, in the healthcare, and to just re-emphasize that we're here for each other. We will always be a community of healthcare providers for our Madison community, and we will be here in time to come. So thank you all, and thanks to Captime for putting this great symposium together panel. Thank you.